Hello dear friends, I hope you are well. Today I want to talk about one of the most important and, of course, dangerous diseases that many people do not know about or do not take seriously, digestive system cancers. You may be interested to know that digestive system cancers, such as stomach, colon, esophageal, and pancreatic cancers, cause the death of millions of people worldwide every year. According to the World Health Organization, more than 4 million people lose their lives to these cancers every year. This is a very heavy statistic, but what we need to know is that many of these cases are preventable or treatable if they are diagnosed early. Now, an important question. Did you know that these cancers can hide in your body for years without any symptoms and progress slowly? So if you want to know what causes these cancers, what their symptoms are, how we can prevent them and what ways there are for early detection, be sure to watch this video until the end. First, let's talk about the factors that cause digestive cancers. Cancer occurs when cells in the body start to grow abnormally and uncontrollably. In the digestive tract, these cells can form in the stomach, colon, esophagus, pancreas or liver. One of the most important factors is lifestyle and nutrition. High consumption of processed meats such as sausages, hot dogs, and red meat increases the risk of stomach and colon cancer. Why? Because these substances can cause chronic inflammation and damage cells. Second, inactivity and obesity. When the body is not moving enough and too much fat accumulates, the hormones and chemicals that the body produces may stimulate the growth of cancer cells. Third, smoking and alcohol. These two factors can directly damage the walls of the esophagus and stomach and cause cancer. Many esophageal cancers are directly related to smoking. Fourth, infection with the bacterium Helicobacter pylori. This bacterium lives inside the stomach and can cause long-term inflammation and stomach ulcers, which if left untreated, have the potential to develop into stomach cancer. Fifth, genetic factors. People with a family history of digestive cancer are more at risk. Exposure to certain chemicals or pollutants can also increase the risk of developing the disease. So you see, a combination of environmental, genetic, and lifestyle factors cause these diseases. Digestive cancers often have no symptoms in the early stages, which is why they are also called the silent killer. But as the disease progresses, there may be symptoms that you should pay attention to. The first important symptom is unintentional weight loss, which means you lose weight without making any changes to your diet or activity. Second, persistent pain or discomfort in the abdomen or upper abdomen that does not go away. Third, changes in bowel habits, such as constipation or prolonged diarrhea that begin suddenly. Fourth, blood in the stool or vomit, which may be red or black. These symptoms are serious and you should definitely see a doctor. Fifth, feeling very tired for no reason that does not get better with rest. Also, problems swallowing or severe burning in the esophagus can indicate esophageal cancer. If you have these symptoms, see a doctor as soon as possible because early detection can save your life. The good news is that many digestive cancers are preventable. The first and most important step is to have a healthy and varied diet. Try to increase your intake of fresh fruits and vegetables, as the fiber in them helps the digestive system function better and removes harmful substances that cause inflammation. Second, reduce your intake of red meat, especially processed meats. It is better to use plant-based protein sources such as legumes. Third, regular exercise is very important. Physical activity helps regulate weight, increase blood circulation and strengthen the immune system. Fourth, quit smoking and alcohol or minimize it, as these two factors greatly increase the risk of cancer. Fifth, if you have Helicobacter pylori infection, be sure to take treatment seriously. Over time, this bacteria can cause chronic inflammation of the stomach and eventually cancer. Finally, regular checkups and examinations can help detect the disease in its early stages and make treatment more successful. Early diagnosis is the key to successful treatment of digestive cancers. To this end, doctors use various methods. One of the most important methods is endoscopy. This method allows the doctor to view the inside of the stomach or intestines with a small camera and take a sample if necessary. A colonoscopy is also used to examine the large intestine and can detect polyps or precancerous lesions. Blood tests, such as tests for occult blood in the stool, can be a sign of internal bleeding that may be related to cancer. Advanced imaging such as CT scans and MRIs are also used to determine the extent of the disease. If you are over 50 years old or have a family history of digestive cancers, it is recommended that you have these tests done regularly. The earlier cancer is diagnosed, the easier and more effective the treatment will be. During my teaching career, I have encountered many patients who had delayed seeing a doctor due to ignorance or fear. Many of these people could have controlled the disease or even recovered if they had visited earlier. This experience showed me how important it is to provide information and how much it can save lives. So, dear friends, I want you to take your health seriously and see a doctor without fear or delay if you see any suspicious symptoms. In conclusion, I urge you to see a doctor if you have any of the symptoms I mentioned, or if there is a history of digestive cancer in your family, and get the necessary tests done. Maintain a healthy lifestyle, improve your diet, exercise, and quit smoking and alcohol. If this video was useful to you, please be sure to like and subscribe to the channel so that we can learn more about health and biology together. Thank you for being with me so far. Good luck and stay healthy.